Hello, everyone. Today we have a new interviewer, Carolina from Colombia, correct?
That's correct.
Yes. So, Carolina, can you explain us what's your field of expertise? Where do you work?
Okay, so I am a medical doctor, general physician. I worked for a children's hospital and I have my own private practice based on integrative medicine with
Hmm.
a specific focus on energy medicine, which is what I'm really passionate about.
Okay, so you combine the both ways.
Exactly, both worlds.
Okay, it's a different path. Okay, can you tell us
It's
a
a
little bit
beautiful path
about
to
your
combine both.
yeah. Can you tell us a little bit about your application of Biowell in your practice? In which of these two branches you are mostly using Biowell?
Okay, so it's been a wonderful experience. I've been using Biowell for about 1 year when I trained with level one and level two,
Mm-hmm.
and I used the device for assessing my patient's energy field and assessing how it changes before when they arrive to my office, and then after we've done a treatment of energy medicine or a nutrition intervention or anything related to lifestyle choices and lifestyle. So we'll assess how the energy field changes after that. And it's been a real pleasure for me and for the patients to get to see how their energy field changes really visually. It's a real helpful tool for they to see how it changes, because when you get to go to energy medicine practitioners, you most of the times just trust that your energy field was corrected or was intervened. But with the BioWill, you can really see what's going on and what are those specific points in the body that are having specific alterations in the energy.
Okay, how do your clients perceive the information that Biowell shows? Because for many people, I think it's something new and that they're not used to.
The most common reaction that I get is they are really shocked, like they cannot believe it because they have never seen something like that. It's a really innovative, or yes, really helpful tool, but that's what they feel. They are shocked and they are impressed by the device, by the outline and everything that they see. It's really easy to understand. So it's most of the times they don't get confused, but they get really happy for what they
Mm-hmm.
see.
So do they get the sense of it and they do understand? Well, you of course explain them what's the essence of it. So do they more or less understand the meanings of all these images and glow that they see on the screen?
Yes, like you say, Dimitri, I'm there for the explanation. But yeah, they really get the sense of stress, how stress changes after an intervention, how
Mm-hmm.
inflammation might also vary after an intervention, and the chakra the chakra tab. It's been also really useful because we can talk about what the person is experiencing in their life in the moment, and then how it changes after an energy session. So yeah, they really get the feeling and the sense of what does it mean to see their energy and their chakras and their points in their field to change. It's really helpful.
Oh, okay, I got it. Very good. So, can you say that you have already big database within a year of practice? So how many cases you already have?
Well, I cannot compare with people that have been doing
No, no,
this
no, no
for a lot of
comparison.
time. But yes, I'd say I have around 150 patients with several measures. At least when somebody comes into my office, I'll do 2 measurements at least.
Right,
So
right.
it's considerable. So I can do research. I'm thinking on doing research eventually because it's useful to have all those data.
So you're not talking about this field on your first work in the medical field?
Well, I did eventually I assessed the energy field of a patient of mine that she had an urinary tract infection. And I asked permission for her mother to do the
Okay.
assessment. And well, she let me. So yes, and I did find some findings of the kidney and all the urinary tract being altered on her energy. So it was really interesting, but I couldn't go just to do it to all of my patients because I had to be careful. But yes, I did that.
Okay, okay. But you usually don't touch this field on the of the alternative, as you say, and energy medicine when you're working in the medical field, yes?
Exactly. Well, perhaps I don't use the Biowell per se. I do use some energy field tools, but I
Mm-hmm.
don't just scan the patients. That I do it on my private practice.
Oh, okay, okay. Very good. Okay, so how do you find the results of the Biowell? How they correlating with what you find and with what results you want to see in your patients?
Okay, so it's completely correlated. I've found that what I mentioned before, the patient can really see how the energy field changes, and the person really feels if the stress has gone down or if the stress has gone a little up. And I've seen some kind of two responses. There are people that respond really rapidly to an energy healing session
Mm-hmm.
and then like immediately, or there are people that respond a little bit in delay, 3 days in delay or something like that.
Oh, really?
But it definitely correlates. The person really feels different, and then the person feels different, and then when we assess the energy again, the Biowell is showing the differences. So it's totally correlated. And
Oh, okay.
sometimes it happens that the person might feel something in the energy session. Oh, I felt this on my left eye. Oh, I felt this on my left arm. And indeed, then the Biowell is showing that specific point. So it's super accurate.
Okay. Okay, thank you very much. So you, according to your feedback, we can recommend Biowell to use in this kind of practice and application. Yes.
I would recommend the Biowell for anyone that's immersed in the energy field investigation and research. It's awesome
Okay.
tool.
Thank you very much, Carolina, for your time, and all the best to you, and good luck in your practice.
Thank you, Dimitri, for the interview.
Take care.
Bye.